The burden of high healthcare costs. The United States stands out globally for its extraordinarily high healthcare costs. For countless Americans, these costs translate into devastating personal and financial consequences. Medical expenses are a leading cause of bankruptcy, and even those with insurance often face crippling out-of-pocket costs. These high costs do not equate to better health outcomes. In fact, in many cases, the health outcomes in the U.S. are comparable or inferior to those in countries with significantly lower healthcare spending. This disparity raises a critical question. Why does healthcare cost so much more in the United States than elsewhere? The answers lie in a complex web of factors, including bureaucratic inefficiency, corporate greed, and opaque pricing structures. Each of these elements contributes to the bloated costs of healthcare, impacting everything from the price of drugs to the cost of surgical procedures. This video explores these reasons in depth, aiming to uncover the roots of this pressing issue. Bureaucratic inefficiency is one of the root cause of high costs. The U.S. healthcare system is notorious for its complex layers of administration, which require significant resources to manage. From insurance companies to hospital administration, the bureaucratic overhead is immense, consuming a substantial portion of healthcare spending. Patients and providers alike navigate a labyrinthine system of approvals and paperwork. For example, the process of billing and insurance-related activities in hospitals is not only time-consuming but also requires a large administrative staff. This complexity leads to higher operational costs, which are ultimately passed on to the consumer. With each administrative layer, there are opportunities for delays and errors, which further inflate costs through corrective actions and delayed treatments. The inefficiency of this system is not just a financial issue, but also a barrier to timely and effective medical care. Corporate greed is fueling America's healthcare crisis. Corporate greed plays a significant role in the high cost of healthcare in the United States. Pharmaceutical companies, for instance, set exorbitantly high prices for medications, far exceeding the costs of production and distribution, under the guise of covering research and development. However, these prices often reflect what the market will bear, rather than actual expenses incurred. Healthcare providers and medical device manufacturers also contribute to the problem. They often charge premium prices because the market lacks transparency, and patients rarely have the ability to shop for lower prices. This lack of competition effectively allows healthcare corporations to set higher prices without fear of losing customers. This corporate profitability is supported by aggressive lobbying efforts to maintain favorable legislation. The deep pockets of big pharma and other healthcare giants fund significant political influence, which in turn protects their ability to set high prices. It's a self-sustaining cycle that prioritizes profits over patients. Pricing opacity, the confusing reality of healthcare costs. The opacity of pricing in the healthcare sector is a critical barrier to cost control. Patients often find themselves unable to predict healthcare expenses due to the lack of clear pricing information. This uncertainty complicates the ability of consumers to make informed decisions about their care, undermining the principles of a free market. For example, the cost of a surgical procedure can vary wildly between hospitals, even within the same geographic area. Without clear, accessible pricing, patients cannot compare options or negotiate better rates. This lack of transparency effectively removes any consumer pressure on providers to lower prices or improve service. Moreover, the insurance industry contributes to this problem. With their complex and often opaque billing structures, patients struggle to understand what is covered under their policies and what they will owe out of pocket. This confusion leads to surprise billing, where patients receive unexpectedly high bills for services they thought were covered. Impact on patients' stories from the front lines. The repercussions of America's costly healthcare system are felt most acutely by its citizens. Personal stories of hardship due to medical costs are both heartbreaking and infuriating. For many, a serious illness or accident brings not only physical and emotional pain but also financial ruin. One such story is of a young woman who, despite having health insurance, was left with tens of thousands of dollars in medical debt after a necessary surgery. Her experience underscores the inadequacy of many insurance plans that have high deductibles and co-pays, placing a significant financial burden on the insured. Another common scenario involves older adults who must choose between paying for medications and other basic needs. The high cost of prescription drugs often forces them to skip doses or forego medications altogether, which can lead to serious health complications. These stories illustrate the dire need for reform in the healthcare system. Political factors: how policy shapes healthcare pricing. Government policy has a profound impact on healthcare costs. Policies that favor the pharmaceutical and insurance industries can lead to increased costs for consumers. For example, the prohibition against Medicare negotiating drug prices directly with pharmaceutical companies keeps drug prices artificially high. Lobbying by healthcare industries also shapes healthcare policy to favor corporate interests over consumer needs. The significant financial contributions made by these industries to political campaigns ensure that their priorities are well represented in policymaking, often at the expense of making healthcare affordable. Reforms aimed at reducing healthcare costs often face stiff opposition from these powerful interests. The challenge lies in overcoming this entrenched resistance to change, which is fortified by substantial financial resources and political influence. A shift toward policies that prioritize public health over corporate profits is essential. International comparison: how the U.S. stacks up. When compared internationally, the U.S. healthcare system is an outlier in terms of cost, without a corresponding return in quality of outcomes. Many developed countries with universal healthcare systems manage to provide high-quality care at a fraction of the cost seen in the U.S. This raises questions about the structural inefficiencies of the American system. Countries like Canada and the United Kingdom negotiate drug prices on a national level, which helps keep costs down. Additionally, administrative costs are significantly lower in these systems because they do not have the same level of bureaucratic complexity and profit-driven motives found in the U.S. This comparison not only highlights the potential for reduced costs, but also demonstrates that high-quality healthcare at lower costs is achievable. The success of these systems provides a blueprint for reform in the U.S., suggesting that a shift towards a more centralized approach could yield significant savings and better health outcomes. Potential solutions: paths to affordable healthcare. Addressing the high costs of healthcare in the U.S. requires bold and comprehensive reforms. One potential solution is the implementation of a single-payer system, which could eliminate much of the administrative waste and profit-seeking that characterizes the current system. This could lead to significant cost reductions and make healthcare accessible to more Americans. Another approach involves increasing transparency in pricing. Legislation that requires healthcare providers to publish standard charges for services could empower consumers to shop around, fostering competition and driving down prices. Additionally, allowing Medicare to negotiate drug prices could reduce the cost of medications substantially. Moreover, strengthening antitrust laws to prevent mergers that reduce competition among hospitals and insurers could also help control costs. Increased regulatory oversight would ensure that consolidation in the healthcare sector does not lead to higher prices for consumers. The role of technology innovations lowering costs. Technology has the potential to dramatically reduce healthcare costs while improving quality and access. Telemedicine, for example, offers a cost-effective alternative to traditional in-person visits, reducing overhead costs and increasing accessibility, particularly in underserved areas. Advanced diagnostics and AI-driven tools can lead to more accurate and quicker diagnoses, potentially reducing unnecessary treatments and associated costs. These technologies can streamline administrative processes as well, such as by automating billing and patient records management, further cutting down on overhead. Moreover, technology can facilitate better patient education and self-care, which can prevent illness and reduce reliance on expensive medical interventions. By empowering patients to take an active role in their health management, technology can help mitigate some of the systemic costs associated with reactive healthcare. A call to action for reform. The high cost of healthcare in the United States is an unsustainable burden on individuals and the economy. The system, as it stands, is fraught with inefficiencies and dominated by corporate interests that drive costs higher at the expense of patient care. It is clear that substantial reform is needed. Policymakers must prioritize the health of the nation over the profits of the healthcare industry. This includes enacting policy changes like increasing pricing transparency, allowing Medicare to negotiate drug prices, and considering more radical shifts such as moving towards a single-payer system. The time for incremental changes has passed. Bold action is required to dismantle the existing structures that contribute to exorbitant costs. Only through comprehensive reform can we ensure that healthcare in America is affordable, transparent, and fair for all citizens.